Hello and welcome to this live commentary broadcast from the Global Forum on Nicotine right here in Warsaw. I'm Will Godfrey of Filter, and I'm delighted to be joined today by two of the most prominent and resolute advocates in the tobacco harm reduction field. We're going to be discussing some early thoughts from the conference and then probably engaging in something of a race to the bottom when we talk about policies in their respective countries. Next to me, we have Fiona Patten. We like her even though she has a background as a politician, having served as a member of the Victorian Parliament for 8 years. But more broadly, she has a decades-long background in civil liberties, including sex worker rights and decriminalisation. She was instrumental in some of the progress that Australia has made in implementing safe consumption sites for people who use drugs, and much one of her causes. I'm also delighted to be joined by Samrat Chaudhry. Samrat has a background as written for many publications, including, I'm lucky enough to say, my own. But for years now, Samrat has been at the very center of tobacco harm reduction advocacy in India, a country where those efforts require unusual dedication and no little courage.
Thank you.
So we'll start with you, if I may, Fiona.
Yes.
Now, this is officially the first day of the conference, but actually things were underway long before now, and I know that you hosted a consumers meeting yesterday, so I just thought I'd start by asking kind of what the mood was that you experienced there and some of the points that were up early on.
Yeah, thanks, Will. We had a consumer forum yesterday, and we got an update from the various regions around the world. So from North America, Central America, or Latin America, Europe and Asia Pacific. And I'd have to say that there was actually some optimism, which, yes, obviously not from Australia, but there was optimism starting to see governments moving towards regulation of tobacco harm reduction products and in particular vaping products, which was really encouraging. It was one of the interesting comments that was made was that some of those countries have recently introduced legislation around taxation, but they haven't
Went to the World Health Organization's
Oh, you were
top
one of the
10.
good cops, were you?
Well, in theory, yes, and it was very prominent, the kind of the anti-vaping rules there. There were signs everywhere, and midway through our event, we had notification that Panama's investigative journalists were looking into reports of vaping going on in hotels, which was definitely not happening at our event. And Indonesia too. I mean, I noticed some of the data that Professor Fahl presented in his keynote this morning, showing that it's a country with a very high smoking rate and with a significant proportion of the world's people who smoke, and I'd made a mental note of that because it's not a country I've heard very much about in sort of conversations and coverage, and so perhaps
it's a very quick developing country, isn't it? So it's growing economically very swiftly. So the cost of illness will be. They'll be starting to take notice of that as they have a rising middle class in that country. But yes, I mean, it's interesting seeing these countries that certainly around Australia that are taking a different approach and using taxation and seeing the optimism of consumers to hearing that taxation actually gave them some surety that the product would remain legal.
Yes, that's an interesting way of looking at it. We've heard a lot about the kind of the conflict of interest already of governments that make an awful lot of money from tobacco sales.
That's right. And yesterday we also had a session on taxation and looked at the sort of the absolute immorality of some of our very high taxes on tobacco products that ultimately impact those that are least able to afford it.
Yes, indeed. Thank you. And Samrat, I know that you've arrived a little bit more recently, but I also know you're going to be involved in plenty this week. Would you give us a look ahead to some of the issues that you're going to be discussing and some of the things that you'll be looking out for?
Well, you know, I mean, India is the poster boy of prohibition, right? So, you know, there isn't...
we are going to fight over that title.
We are competing for that. So, well, you know, things are things could be better. I think they could be, we could, so there is prohibition, but there's also some room, at least in the smokeless tobacco, in the nicotine pouches or snus space, smokeless tobacco is actually the biggest problem in India because there are 200 million users, which is, twice as many smokers, and there are no laws against banning nicotine pouches yet.
Yes. And to be clear, when you say smokeless tobacco, you're not talking about sort of really very safe products such as snus, but you're talking about a really wide variety of different forms.
So this is like deadly toxic SLT, which causes about 350,000 deaths every year. So there is huge room for improvement in, for harm reduction in that space. Also because these products are used by the poorest of the poor, right? Because they're very cheap. So and risk reduction for that population can be really beneficial.
Yeah.
So there is some movement on that front. There is a new government. I mean, it's the same government, but a new dispensation. We have a new health minister. So there is some reason for hope. Let's see, how things progress in the next month or so. We'll have some inclination.
Yes, yes. We'll return to that optimism in a moment, but I also wanted to bring up something really negative that you actually wrote for my publication about recently, which is just sort of the atmosphere of censorship and some of the actions that are taken that are clamping down on even discussion or criticism of the ban that exists. Can you tell us about that?
I think globally there has been, press freedoms are falling everywhere, and in some places they're falling faster than others, and especially in developing countries, especially with authoritarian governments. So India's rank on the Press Freedom Index fell like really sharply over the last 10 years. So there is that. And then there is also the government, in the name of public good, thinking that it's morally correct somehow not to discuss risk reduction products because it's in violation of the vape ban. So a lot of publications could have stood up against it, but it doesn't to them sound like a big issue, So there we are, and then, but there's also social media. So, like in these elections, what we saw was that a lot of people moved away from mainstream media, and social media just really shone through. There are a lot of independent journalism.
Yes.
So there are ways to get around that. So there is censorship. It is quite disheartening, but there are options.
It's interesting that you say that because in Australia, we're also experiencing this censorship around tobacco harm reduction.
Is that right?
And it's quite insidious, and it's something I actually haven't spoken about. But whenever you try and place an editorial piece on tobacco harm reduction, or whenever you try and speak to a journalist around tobacco harm reduction, and we've had academics and experts coming into Australia to speak to our politicians, we cannot get media interest in it. The media will not report. In fact, we tried to, even at our press club, have a conversation around tobacco harm reduction, and even the press club said no. So it's something we haven't spoken about in Australia a lot, but it is it's becoming really difficult to have those conversations, to have a conversation if you are speaking about tobacco harm reduction.
Really?
If you're speaking about prohibition, well, you'll get the front page.
Yes, yes.
Also, I think if I may just, add one point and why that problem is.
Yeah.
Because, people talking in favor of prohibition are all big doctors, very well known, they're government officials. So there is an imbalance, and the people who are talking in favor either are scared to talk about it publicly or they are advocates, consumer advocates who do not have that kind of, so for journalists, they also find it difficult to balance, and that could be one of the reasons why there is so little coverage.
I don't think we've had a positive story on tobacco harm reduction that I can remember.
Yes.
I don't think we've even had anything that would even be what I would say balanced.
And to sort of recap some of the negatives at the moment, I mean, you term it prohibition. I know advocates like Dr. Colin Mendelsohn do as well. I mean, it's theoretically legally available, isn't it? But in practice, not so much. What's the extent to which it's inaccessible, and what are some of the impacts that you've already been seeing from this effective prohibition? Prohibition just creates
an opportunity for criminals. And that's exactly what has happened in Australia. And so, yes, you're right. I mean, technically, if you have a prescription, you can have access to nicotine products, and you can access vapes through a pharmacy. The same could be said for prohibition in the 1920s of alcohol. I mean, it's famous that Winston Churchill, when he travelled to America, got a prescription for alcohol so he could carry his scotch with him. So it is prohibition. But just today I had a message from a friend who is desperately looking to get a vape, and she had always used a dual pod device, and she now can't. And it's impossible for her to get anything. I think there's 2 products available legally. One is a Philip Morris product, and the other is a product that was introduced by a former health minister. So it's, I would say, corrupt.
And if you jump through the hoops and you find a GP who will actually prescribe nicotine, and you go to the pharmacy, then it's extremely expensive on top of that, isn't it?
Extremely expensive. And for example, if you lose the device, you've got a pod device and you lose the device, you have to get another prescription to get another device. And it's not covered by our health insurance or our national program. So it's an $80 to see the doctor, and then around another $80 to purchase the product. So when we know that the people who would most benefit from this are the poorest of our nation, the underemployed, and those on the lowest salaries, the idea of spending $80 to see a doctor, and then the idea of spending $80 at a pharmacy is beyond the reach of many, and illicit tobacco or an illegal vape product, they can still purchase.
And as with India, this has all been done in the name of preventing youth use. Has it seen any sort of success on
No,
that front?
and really quite the opposite.
Yes.
Really, for a young person to buy a packet of cigarettes a couple of years ago, it would have been quite difficult. There was hefty fines for any retailer that supplied a young person with a tobacco product. Of course, now, when the products are all illegal, there is absolutely no regulation of that. So we're seeing young people saying that it's extremely easy to purchase vaping products either online or at convenience stores, supermarkets, anywhere.
Yes. And Dr. Mendelsohn recently noted that in some age categories, youth smoking has actually risen, which I suppose is if you present vaping as bad for you as smoking, then people think, well, what's the difference?
And some of the products that they were accessing were, they were very unregulated products. They had very high levels of nicotine in them. Yeah. And so you've got young people who have not smoked accessing incredibly high levels of nicotine in a very sugary flavour. And we were seeing experiences of nicotine dependency, and some of them were actually moving to cigarettes to reduce their dependency on their vapes. I mean, it's created these completely perverse outcomes, and most of the youth vaping is experimental. There's most people they will try it and then move away, but some of those perverse outcomes we are seeing people moving to cigarettes.
Yeah. To turn to a more optimistic note, Samrat, beforehand you were telling me about some media-related action that you and your colleagues are planning around publications that timed for World No Tobacco Day, which passed recently. Are you able to sort of share some of that publicly?
Yeah, see, so one, there is this huge imbalance, right? So this World No Tobacco Day, in a country where 1.35 million people die every year from tobacco use, there was a flurry of articles talking about why vaping is a problem. So if you weren't from India and if you were just tracking news, you would think that India's problem is vaping. which it is not, and not a single Indian has died from vaping, right? So this entire shifting of media narrative towards and a lot, the same litany of lies, popcorn lung, and I mean, we've heard those before, right?
Yes.
And they have been rebutted, and they just still keep surviving, and we don't know how. So what we have decided to do is take each of them and publish a detailed rebuttal of each, so that the media knows, the people quoted in those articles who are doctors, they know. So I mean, it's one way of fighting back. It's one way of responding against this narrative in the ways that we, who don't have those kind of resources, can do. And social media is a leveler in that sense.
Yes, yes. And so sticking with the optimism, at Filter we were lucky enough to be able to send our ace tobacco harm reduction reporter Kiran Sidhu on a
great.
reporting trip to
Yeah.
India recently, and I know that she was supported by a KAC tobacco harm reduction scholarship, I should say. I know that you were instrumental in many of the contacts that she made in Mumbai. Thank you for that.
My pleasure.
But what she gleaned from some of your fellow advocates was a degree of medium-term optimism centered around some of the financial incentives that could be created. Since then, of course, we've also had the national election in India with a much reduced majority for the incumbent. I'm interested in any implications of that. How would you assess the kind of prospects for medium-term optimism on those bases?
Well, see, for one, the ban didn't work, and like Fiona was saying, it actually made the problem worse. Earlier, there were mods and pods available. The vendors, they wanted to, play right, and then there was self-moderation. They were sharing information and not selling to minors. But now it's a black market, and these are cheap, disposable products with high nicotine levels, with no consumer protections also, because you don't know what you're buying. And by the time a smuggled good lands from China or wherever in the hands of the end user, it's a year and a half old. So, so we don't know what's in them. So I think what's happening also is that the government and the tobacco companies, the local ones, are realizing that if everyone is using them anyway, we might as well, then regulate it, earn some revenue from it. So there is some indication of that happening. So that's where the optimism coming from. We aren't sure, this could go either way. Recently CTFK's funding was restricted because they were pumping it. I mean, they're the main
Campaign
driver
for tobacco-free kids.
Campaign for
yes,
tobacco-free kids.
yeah.
So they're the main driver of anti-vaping propaganda. They are the ones who are funding, and with the Bloomberg Philanthropies granting $420 million to be spent in LMICs, a major portion of which was coming into India through CTFK.
Yes.
So that funding being restricted also is an indicator that things might be changing.
Yes.
In the end, it could just well be that they want to make revenue from these products, which people are using anyway.
Yes.
Yes, yes. And then sort of switching that to Australia, how do stances on tobacco harm reduction play out along the lines of party politics? I mean, would a change of government potentially see a change of direction, or is there some degree
Look,
of
it was the
consensus?
previous government, so the previous sort of Conservative government, that introduced the initial bans and really started the ball down this prescription-only model. So I don't hold much hope out for them. However, we've got some legislation coming up in the next few weeks that's to further prohibit the importation of vapes. I mean, it's effectively a ban on a ban, so it's fairly ineffective. However, there is much disquiet and concern about this legislation coming from both ends of politics. So our Conservative party called the Nationals, they won't support the legislation. And then probably our more left-wing and more progressive groups, the Greens, are also expressing concern about this legislation. So the legislation is very uncertain to get through the Senate, where the government doesn't have the numbers. And this does open up an opportunity. Again, it's very hard for a government to do a U-turn on a policy. However, if we can get them to relax,
have caveats, to build in some.
To relax in some ways, we may start to see a slightly better conversation occurring. But unfortunately, I don't you know, I don't think we're going to follow the UK or even our brothers in New Zealand.
Well, speaking of New Zealand, I mean, when you look across, this is a comparison often made, and I know that there have been some New Zealand events held already here, related events, I should say. And I mean, how would you assess that comparison and are the contrasts?
New Zealand
Not
and
obvious.
Australia are extremely competitive.
Yes.
You know, there is a significant rivalry there. We beat them in football sometimes. We beat them in cricket very often. But here in tobacco harm reduction, they are miles ahead of us. And we bring out New Zealand doctors, we bring out people from Quit in New Zealand to speak to our politicians about the success of their program, the success of their model, and it seems to just fall on deaf ears, generally speaking. I think, you know, New Zealand's got some of its own issues, and certainly the notion of putting the tobacco ban in place.
I was going to say that's something that somewhat divides tobacco harm reduction advocates, in my experience.
Yes.
I would assume that you would oppose, as a civil libertarian, you would oppose that.
I do oppose it, and I think, you know, any form of criminalisation is not the answer.
Yes. Maria Wood-Glover has written for us about how it will disproportionately fall on Maori population.
Of course it will.
Yeah.
Of course it will. And, you know, we see, well, any form of prohibition and any form of regulation or prohibition like that generally falls on our most disadvantaged people in our community, whether that's our drug policies or our smoking policies or whatever else it might be. I understand that the new government in New Zealand is less enthusiastic about this ban, so they may see some rationalisation and they may actually see some improvement on it. Of course, there are, you know, the flavour bans that are gaining popularity in other jurisdictions.
Yes.
They've certainly been raised in New Zealand as well.
Thank you, guys. We could go on a lot longer, as you can tell, but I am getting a voice in my ear telling me it's time to wrap up. So we'll plunge back into the conference proper. Only remains for me to thank you for joining us, and thank you very much again to Fiona and Samrat.
Thanks,
Bye for now.
Will.